Penile implant surgery. Your questions and answers. Brought to you by FixED, www.fixed.net.au.
The treatment of erectile dysfunction should be thought of as a cascade of treatments, starting from simple things, moving through to more intrusive things. And it really depends upon the severity and the cause of the erection problem as to what's most appropriate for the patient. Now, the vast majority of patients with erection problems, estimated about 9 out of 10 patients, will, when they go to their doctor, if they describe this problem, will respond very well to the tablets. You know, as you know, there is Viagra, Levitra and Cialis. They all work well and they do help about 9 out of 10 patients walking through the doctor's door. But there is that 1 out of 10 patients where the tablets don't work, and there are then perhaps more intrusive and trickier things that can be done beyond that. And it depends on the patient's needs, the partner's needs, and his own thoughts about his masculinity as to how far he's prepared to take it. If a man is getting more trouble and he doesn't want to take tablets, some men will respond to a thing called a vacuum constriction device, which is a suction machine that can be put over the penis to suck it up. But the erection with a vacuum constriction device it's a rather cold erection. It's a bit floppy. It does require the use of this machine in the bed, so it's hardly a romantic situation. It does require an enthusiast to use it, so most men don't wish to do these things. But beyond that, if the tablets aren't working and the man doesn't want to use a vacuum device, then erections can be in fact stimulated very nicely with intracavernosal injection therapy. And what that means is taking a small diabetic syringe with a tiny needle, giving yourself, the patient himself, a small injection into the base of the penis on the side of drugs which, when introduced directly into the penis, cause the blood vessels to open up widely and the blood to flow in. So a man who has got cardiovascular damage or nerve damage will often actually produce a very good erection with an injection. Mind you, to do that you've got to have you've got to be taught how to do it, and also you have to have the fortitude to stick a needle in your penis. If the needles are working well, even then too high a dose may lead to an erection that won't go away, and sometimes repeated injection can lead to fibrosis or scarring, sometimes bends in the penis. But mind you, there are many men out there who use these injections very satisfactorily and happily, and I think men should always be offered these treatments if the tablets aren't working and a pump's not suitable. Now, beyond that, if a man just doesn't want to use injections, or they don't work for him, and he's tried the other treatments and they're just not right for him, there is a cure or permanent solution to erectile dysfunction by having a penile implant inserted. And this is an inflatable device which is put inside the penis, deep within the penis. Nothing can be seen from the outside. It's done through a very small incision just above the penis. It is simple surgery that takes maybe 30 to 45 minutes and puts you into hospital for 1 or 2 days. It is a good solution, but again, it requires a man to think this through, talk to his doctor, talk to his partner, and then for the partner and the doctor to go along and discuss it. And I think once you've thought this through, there are a lot of men who've worked to the end of the chain of treatments who may be happy to have this surgery because it will be a solution to their problem.
Penile implant surgery. Your questions and answers. Brought to you by FixED, www.fixed.net.au.